Hi, everybody. I'm Dr. Stavros with USMLE Trainings, and today we'll be discussing strategies for success on your USMLE Step 1 exam. In order for you to do very well on any exam, first things first, you need to be aware of what the exam is about. You need to be aware of how it's structured, what challenges you might be facing on this exam, and then address step by step how to get there to then attack and do very well. So what is the USMLE Step 1 exam? Well, it's one of 3 tests that you must take to get licensed as a physician to practice medicine in the United States. It used to be a numerical value score. Now they changed it to pass or fail. Many students out there feel that it's easier, it's more doable because it's just pass or fail. So then why is it that the numbers are rising of failures in Step 1 exam? American students, international students, both Caribbean and abroad, the numbers are dropping for passing on first attempt because perhaps students feel that they don't have to study as much. Perhaps they don't dedicate enough time, invest enough time to study. Maybe they wait to the last minute to study, to cram for this exam. Unfortunately, you cannot cram for this type of an exam. So, used to be a value, number, numerical value. Now it's pass or fail. That actually puts pressure later down the line for step 2. We'll talk about that on a different video. Now, for step 1, it's an 8-hour exam, 7 blocks of 40 questions. Random questions, timed, and difficulty levels range with their own difficulty level of rating, 1 through 5, whatever it is. So basically, it's difficulty levels ranging. It is a difficult test because it's timed and you have to sit there all day long. You have certain breaks you can take within each block. Within that 8-hour span, you have 1 hour to use as a break. Out of that 1 hour, 15 minutes is used for an orientation video. So quick tip, practice watching the video numerous times, expose yourself to the video once, twice, thrice before your exam. So when you walk into the exam, you use those 15 minutes allocated to the video to your time of break later throughout the day. You navigate through the video, it'll take you a minute, and the other 14 minutes will be used for you for whatever break is needed throughout the day. Overall, no matter what we say today in the conversation, this video, as far as common mistakes to avoid, you have to practice endurance and stamina before you walk into any exam, especially step 1. A lot of students perhaps study and they answer 3, 4, 5 blocks a day. Then they're walking on exam day and they don't do well because they realize after the test is taken that they couldn't perform at their best, especially in the last 2 blocks. So that's why we here at USMLE Trainings do our very best to provide as much knowledge as possible for you to know as much as needed, if not more, to walk into this exam and actually pass the test on first attempt. Okay, so in order for us to make sure we don't make certain mistakes, we need to acknowledge common challenges faced by you, students that have reached out to me, students that have worked with me, that I've worked with throughout 10, 15 years of my career in working and preparing medical students and physicians to pass a step 1. That's why I'm bringing it to you today, so you're aware of what common challenges are being faced or were faced or will be facing when you're studying for your exam preparation. Okay, Doc, now we're going to talk about common challenges that are faced by students like yourself during exam preparation. And I've seen these pop up over and over again through my 10 plus years of working with students, med students, physicians, DO students, you name it. So I wanted to bring up to you the common mistakes to avoid so you can avoid them. All right. First one, reading from top to bottom. Now, I used to do it too. I think we all have done that at some point. It makes more sense. It makes most sense to go top to bottom. Why wouldn't we? Here's the issue with that. If you go top to bottom, you're reading the scenario, and as you read the scenario, you're formulating an answer perhaps. You get to the bottom 2, 3 lines, and the answer is provided to you, meaning the differential that you thought you were supposed to come up with. Now you panic. Now you freak out. Now you stress because you weren't paying attention to the other details, right? So that's why reading top to bottom in not a simulation environment, maybe every day, day to day, which is not related to USMLE at all, can work for us, but on this exam can hurt you. Because what you don't want to do is panic and stress out and freak out on exam day. So that's why reading top to bottom is not beneficial. It's a common mistake the majority of students do make. For us, I advise read the last 2 to 3 lines at the end of the last 2 to 3 lines, because then not only do you know what the question's asking of you, but at the same time, you might be able to get some juicy information, right? A differential, perhaps some lab markers, some lab findings, something that's going to be able to allow you to differentiate or to pinpoint a specific condition, okay? So if you're doing that now, I would suggest for you to stop, slow it down, read the last 2, 3 lines, at least the last line, to then go to the top and attack the whole scenario. Now you know what they want from you, and you already you're able to focus specifically on what the question is going to be asking of you. Okay, good. So next one is not highlighting. Well, I can tell you this. Many students feel that highlighting is actually a waste of time. I'm going to show you now why not highlighting actually is a waste of time. In the regular scenario, out in the real world, take your time, read the scenario, enjoy it. On a STEP exam, USMLE Step exam that's timed, every second counts. So if you read the whole scenario, 1 paragraph, 2 paragraphs long, and you don't highlight the pertinent findings, what happens if you perhaps don't know what the answer is and you have to mark it to come back to it later throughout the whole block? You come back to it at the end of the block, you're not really familiar with what the findings were. Because of that, you have to read it again. That's why I know it might feel that it's more time consuming now, but I can promise you, as you read the scenario, just highlight what you think is important. So then after you finish reading the scenario, look at the findings, say, well, I highlighted certain words, which mean to me that this is the pertinent information that I need to formulate a differential. And if for some reason I don't know the answer, it's okay. I mark it. I go on to the next question. I come back to it later, and I don't have to read the whole scenario. I can just go ahead and read the highlighted parts, and then saves me time to then formulate an answer. So please, if you don't highlight and you just expect to read, and get the information, it might be beneficial now, maybe at the beginning of your studies, but it will catch up to you. And if you don't believe me now, wait till you get to Step 2 CK, where in that scenario, in that realm of USMLE world, you have 3, 4, 5 paragraphs per question. So you see, practice your skills now, perfect your skills now, and I can promise you, you will use them to pass this exam, Step 1, and eventually score higher on Step 2 CK. Okay? Good. Next one, reading the question twice. I've seen it happen very often. People go to me, students go to me, Doc, I can't finish the block. Why not? Well, I just can't. And I ask more questions. Well, tell me, what exactly is the reason why you can't finish a block of 20 or 40? They then tell me that they read the question twice. Okay, there's no way you could finish any block of questions in time allowed if you read it twice. I then ask, why are you reading it twice? Well, they say, I skimmed through it once. I go back, I look at it again. If the test was not timed, I would say, doctor, you could do whatever your heart desires. Because this test is timed, this approach will never work. Why not take your time, sentence by sentence, right? Read the last 2, 3 lines first. Well, that sounds familiar. Go to the top and highlight what's important. That sounds familiar too. So then you don't have to read it twice. And if you had to read it a second time, you don't read the whole question again. You just read specific pieces that you've highlighted. You see? So I know this might be a few of you watching now, this recording, this video series. And if it's happening to you now, don't worry. Take a step back, take a deep breath and say, well, I can't physically read the same question twice. It's impossible to finish the block at all. So break the habit. I know it's difficult. Take your time. There's no rush. You don't get points for finishing the test faster. So if I got you at your earlier stage of USMLE, which I hope I have, I'm very happy to hear that, because then I could teach you the better ways and to avoid these mistakes and actually build better habits of studying and test taking. So if this is you, take a step back, just take it line by line. Do not read the question twice. It will kill your time. Next common mistake, reading fast and missing info. I was a king of reading fast and missing information. I would read, fast, click the answer and move. I then look at the answer choices after I get my score and realize that maybe 15, 20 questions out of 40 were incorrect, not because I didn't know the information, because I literally read so fast that I missed key information, key findings within the scenario, which if I only slowed down and put the brakes on, which I don't like to, but when I put the brakes on, I then understand what findings are in the case to then put them together and then gain the wonderful right differential to get the right answer and move. If you want another example, picture yourself in the hospital and you just run in and run out. You didn't give enough time to read or actually ask the right questions to the patient you're seeing to then get the information. Or you're reading a chart nice and fast in the hospital and you miss so much vital information that the other doctor goes, I know you thought it was this condition, but clearly this states this person is presenting with this. That's why. Please don't do what I did, because I actually fixed it to then pass my boards. I want you to fix it as well. Put the brakes on. If you're reading too fast, that you're actually in a better position, because that means you could read faster than those who can't read fast enough. So that's a good thing. But you can't do that on the exam. So please listen to me. Starting today, starting after you watch this video, when you are answering questions, put the brakes on. Do not speed. Do not go super fast. You will miss vital information, and then you're in trouble. Again, I'm teaching you this because after you pass step 1, you must pass step 2 and score very high when the time comes. So in step 2, like I mentioned earlier, it's usually 2 to 3 paragraphs long. So you need to be able to read fast and be able to extract all the positive information, all the pertinent information that's needed. So practice the skills now. I'm happy I got you now, so you can become better and better at the content as well as skills for test taking and avoiding these mistakes so you don't make them now and later, especially when now counts and later. Okay, Doc, the next common mistake most students make when they prep for step 1, immediate focus on answering questions. Okay. I have to admit, I made the same mistake. I was told by school administration I should answer 200 to 300 questions a day. That is wonderful advice at the wrong time. It's basically saying, go to the hospital and go see patients, round on patients, come back with differentials, but not actually know the content. So we all have a habit of jumping and just going for questions. And then what happens is we don't know the information. Maybe we're not familiar with the content. Maybe we don't know the content. We forgot the content. We just never learned it. And we get the questions wrong. And we get upset. We get mad. We get stressed. Why are you stressed? Why are you panic? You don't know the content. So that's why typically, I know it's tough, but typically, clearly, you're in med school. And typically you go through the material in med school to then have enough time to invest in studying for STEP. What happens though is either we procrastinate, where it's hard during class to learn the content, review the content, and study for USMLE. So I get that. What happens is you go to med school, you learn as much as you can, you study to survive, to do well, to learn the content. Then later you have a certain time frame to pass STEP because it's not as long as you want usually. Cram. You figured, I did learn biochem a year and a half ago. I did anatomy. I learned MSK. We did cardiology. I'll just start answering questions. Okay. And typically when you do that, you don't do well. And then you start panicking, figuring out, you start wondering what you're going to do. That's why many students make this mistake. Because you read something or you learned microbiology a year and a half ago, doesn't mean you know it all. If it does, congratulations. Amazing. But if you don't, that's why we typically review all the material once more from the beginning, embryology, anatomy, histology, general phys, pharm, path, and so on. And then as we review the content in more of a USMLE prep focus, right? Then we start doing questions. And don't start jumping at 200-300. Start at 20, start at 40. Build the amount of questions because, hey, I can go hit 1,000 golf balls outside. Doesn't mean I'm going to be amazing in golf. I'll keep hitting the ball to the left or to the right. I then would say hit 10, 20, 30 golf balls. Assess each golf ball swing. See why you're swinging, why the ball's not going straight. Keep adjusting, keep assessing, keep improving. And then later you can get to that 1,000 balls a day when you're hitting versus a couple hundred questions doing a day or answering it on a daily basis. That's why if you are doing this, please stop. If you see that you're answering all these questions and you're not improving in score, there must be a reason. You need to know the content first before you start attacking questions. Q banks are not meant to teach you medicine. They're meant to check to see if you know the content. We, however, in society have adapted the Q banks as another form of learning. Yes, to a point it is. But if you don't know the material, how can you answer the question? If you don't know what a patient presents with chest pain, how can you walk in and present a differential of any type of chest pain? You don't have it, right? That's why you go to school for 2 years, then you study for STEP, take the exam, go to rotations, take step 2, and then go to residency for 3+ years. You have to constantly practice to learn the information to then move forward. So if this is you, please stop. Don't jump straight to questions. Take a step back, learn the content first, and then as you answer more questions, you keep learning the content, right? There's no pressure. But if you take this jump, you won't see a high rise. You won't see a high rise in your score, or a score for that matter that you like, to then have to go back and do the work again. So I hope that helps, and I hope you don't do that. You get back to learning the content, then focusing on answering questions, and then speeding it up to doing more questions a day. The next common mistake that most students make for prepping step 1, not eliminating correct answers. So I know, and I know you know this, the easiest way, answer the question and go. Answer the question and go. Of course, because it's a stressful day. It's a timed exam, 8 blocks. It's a timed exam. It's a timed exam, 8 hours, 7 blocks. However, if you answer the next question and the next question pops up and you don't have an answer, you might panic. You might say, well, I don't see an answer choice in front of me. I know what the answer is, I just don't see it. Well, if you don't practice this technique of eliminating all the wrong answers, then you just walk in and hoping that you read the scenario and you're hoping you get the right answer. Whereas what we do with test taking skills and strategies, we want to know the answer based upon the question stem. But if for some reason we don't have an answer, we don't panic. We don't stress. We say, okay, I read the scenario, read the last 3 lines first, read the whole scenario top to bottom. After reading the last 3 lines, I still do not know the answer. It's okay. You go ahead and you knock out, eliminate all the wrong answer choices. You automatically increase your chances of getting the right answer. So if it's 5 answers, you eliminate, originally it's 20% chance of getting it right. You eliminate 3, now it's 50%, you see? So as you knock out answer choices, you are reinforcing the knowledge within that particular answer choice that you know. So you're reinforcing symptoms and signs within certain diseases, but then eventually you feel more comfortable. You're like, well, I hope I read the question on exam day and know the answer, but if I don't, I'm fine because I have enough knowledge, enough power to at least know 2 or 3 answer choices within those answer choices they provide. So if you do that, I can promise you you're going to get a higher score on the exam or on exam day, or at least on your assessments. I do know though, a lot of you are not agreeing with me because it does take time. But if you do it the right way, you do it this way from now, eventually, when you are answering questions at more of a faster pace, when you are working more extensively and exclusively with test taking rather than content, then you start realizing you can eliminate at a faster pace, right? And knocking out those answer choices that we do on our workshops every day to then have a better chance to get the right answer. So if this is you, start trying now to eliminate the wrong answers. It's quizzing yourself with every answer choice. Why not quiz yourself? Find out, do you really know why those answers are incorrect? Not just say, yeah, I think it's B, let's go. Well, all right, you got the answer, congratulations. Do you know why the other ones are wrong? And if you do that, it is more time consuming, but you will save time later because you don't have to go back and review this at a later time. Next common mistake that majority of medical students do make when they prep for step 1, changing answers too often. There's a reason why we do that. Because we overthink, we second guess, because the questions are written that way. And also we are trained in medicine to double check everything, to really ask many questions, obtain information, double check, ask similar questions or the same question in different ways to get hopefully the same answer. So if you do this, most likely you're probably seeing changing right to wrong, then wrong to right. I'll say that again. When you're using certain cube banks like UWorld, they do show you how many questions you've changed right to wrong, wrong to right, wrong to wrong, right to right. It's important to know. When I was studying for STEP way back when, I was not only, like I mentioned earlier, I zipped through the question, I missed about vital information, but then when I did answer the questions, I would go back and double check and change many of the answer choices to then result in having about 15 to 20 questions right to wrong. You know how that's just horrible, because if you have 7 blocks in a day of 40 questions and you realize you're eliminating, I mean, you're literally changing right to wrong 5, 10 times per block, there's your pass or fail right there. You're looking at 7 blocks, let's say 10 questions. That's 70 questions you're changing right to wrong. So, I can say why people do that. Now I can tell you why it happens more often. Because if you are untimed, right, tutor mode, you have all the time in the world. You go back, think, double think, triple think, boom, change it. If you're going too fast in the actual if you're doing simulation now and you're going step by step and you're going really fast, and if you're finishing about 5, 7, 10 minutes before the end of the block, typically you're going to go back and look at the answer choices, right? Yeah. And if you do that, you have all this time to play with other questions and say, well, that looked good, but let me change it. This looks good, but let me change that. So this is what you have to really avoid. You have to really avoid going back and changing the answer choices. A quick little tip on this one. If this is happening to you, and I know some students I'm working with right now, we're changing this bad habit of theirs, because especially when you go to step two is a numerical value. It's a score, not just a pass or fail. This mistake right now is what can cost many people a difference or cost them a future in certain specialties in medicine, because instead of scoring a 260, they'll score a 240 or 238. You're out for surgery typically because they're very competitive. So if you don't think it's important for step one, it is. But if it's not, if you don't think it is, it will get you later on step two. So fix it now so you don't get caught later with issues of not scoring high. If this is happening, don't change the answer unless you have a specific, unless you find a specific tip, strategy within the question stem that can boost or at least convince you to change. So that was a little tip right now I wanted to give you, because I know it happens to a lot of doctors out there. It happened to me, and I'm saying a lot of this happened to me back then, and I had no one to help me. Eventually I had someone who guided me the right way. And that's why I want to be the guide for you. So if this is happening to you, don't change the answers. I know you know the answer. Just think to yourself, if I change the answer, it has to be for good reason. I have to find something in the question stem that's going to give me enough power, enough evidence, right? Support to say, hey, I'm going to change it. That's it. So do that and don't do that. Don't change the answers too often, and implement what I just said to you right after this video. And I guarantee you start seeing your scores rise. Okay, Doc, we went through common mistakes that typical medical students make when they prep for step one. Now it's time to discuss techniques to improve your scores and efficiency on exam day. The first technique is narrowing down your answers. I know a lot of students don't do that. That's why it was one of the common mistakes earlier discussed. Because of that, people don't do well on exam. They read the scenario, they click the answer, and they move because they want to save time. Here's the problem. A, you're not sure if that was the right answer. B, there's no safety net. There's no checkpoint to double check if you are correct or not. And on top of that, when you don't narrow down your answers, what happens is you click the answer, you move, and then you might have to come back again and overthink, second guess, figure out maybe I missed something, versus taking the time to read the scenario, taking the time to eliminate every answer choice that is impossible to be the right answer, to then eventually either have the right answer or narrow it down to two. And if you have maybe down to two, it's 50-50, which then you feel comfortable to say, no matter what, I've taken maybe 20% chance of getting it right. If there was 5 answer choices, clearly if it's more than 5 answers, it's a lot less. So it's either I have 10 to 20% chance of selecting the right answer, versus I took my time, I eliminated all the answers that I know can't be right, and then I end up having a 50-50% chance of getting it right, versus 100% because I've eliminated all the wrong answers but one. Now I know it's challenging, because that means, or that tells me, or that should tell you, you need to know a lot of information about everything around you when you're studying. Yes, that's true. So it's intimidating when we say that to students because they go, well, I just don't know why it's wrong. It's okay. Start off with just eliminating what you feel is wrong. As you improve with your skills, improve with your studies, you eventually challenge yourself and say, you know what? I now know that it's not B because. I now know it's not C because C would be in an older patient versus the patient here is a pediatric patient, you see? So don't panic and don't stress. You have to be effective and efficient on exam day. You have to walk in with a certain formula, with a certain system. The system is what we provide to you. You walk in confident and you answer the question. At the same time, you're not sure what the question's asking or you don't know what the answer is, don't panic. Plan number two, second part of the system, is eliminate all the answer choices that you feel are not possible. So now either you have one left, which is the right answer, or you eliminate and you have two left, and then at that point it's 50-50. So you do that, you will definitely improve your score on exam day. You'll minimize any kind of overthinking, second guessing, because you double checked everything. You went through it, answered the answer choices, you eliminated what was incorrect, and you have a better chance of being more confident that that's the right answer. The next technique to improve your scores and efficiency on exam day, specifically for step one, marking and coming back. I know the majority of you are against this. So I will begin by saying, if you attempt this technique, you have to practice it from now and keep practicing it before exam day and it will work. Let me explain. Typically when you're answering questions, timed, right, in a timed manner, 40 questions, you answer the question, you move. You answer the question and move. Now, if you don't know what the question's asking of you, you don't know what the differential is, you're kind of confused and maybe you're just second guessing yourself, what do you usually do? I advise this, and I know it works. Look at the answer choices. You have no idea. Either the answer choices aren't speaking to you, it's a biostat question, you're just scared of it, there's some formula, something going on. You mark, you jump over and continue with your simulation block, because if you do it like this, it's basically saying, okay, I'm not ready for this question. I don't know how to even approach it. I have to stay in my study, my zone, my study, my prep zone. So I have to stay focused and concentrating and stay concentrated to then move on with my next questions in the block. Because at the end of the block, when you're done, you say, okay, I finished my block of 40. Yes. I have some flags on previous questions. Yes. I'm safe and I feel comfortable that my 40 block is complete ideally. I have to go back now and look at the ones that I marked. I look at them a second, third time. Perhaps I've eliminated a few or I haven't even looked at them. But think of it. If you are offered or allowed 60, 62 seconds per question and you pop up the next question, you don't like it, you flag and move, you just save 60 seconds. It's added to your time, meaning you haven't wasted it, right? So ideally, if you flag, if you mark and come back to it, it's going to allow you, the student, the test taker, to feel more comfortable, more confident, stay in your zone to move on to the next questions. Because if you don't do it this way, what happens is you attack the question, you're challenged, you feel tortured, you feel stressed, you're not sure if it's even right. You spent 4, 5, 6 minutes on the question, you mark an answer out of frustration and you move on. Now, all the other questions waiting for you, right? Let's say it happened on question 20. The other 20 questions that are expecting, waiting for you to answer, you might rush because the time is counting down and you wasted 5, 6 minutes on the previous question and you're not even sure if you got it right. So what happens next? You rush to finish the block. Typically, this happens to a lot of students. And because of that, they say, well, I didn't score high. Why? Well, I spent time on one of the questions. It got me 4 or 5 minutes. And then I was rushing to finish the block. Guys, why would you let that happen to yourself? Okay. So one answer to a question that I most likely think that you have right now is, well, doctor, what happens if I mark the question and at the end of the block, I don't have time to go back? Well, that's a very fair question. So that's why I said earlier in the beginning of this technique, if you begin to implement this and you want to implement this, I hope you understand it takes time to perfect it. Meaning, flag the question, move on. At the end of the block, come back and attack. If you practice this, I promise you, you'll have enough time to finish the block of 40. Because if you don't practice this and you do it on the game day, exam day without practicing, yeah, what's going to happen is you flag, you jump over, leave it empty, and you come back and to reread it again, and perhaps you run out of time. So to add to that, if you flag and come back to it, you can do two things. One, flag and jump over, leaving it empty. So then you come back the second round to have a fresh approach, fresh look at it, to actually have a fighting chance in answering the questions and knocking them out, versus flag and before jumping over, select an answer that perhaps you might feel is the answer, versus just choose an answer. So when you come back later, if you do have a chance, you can answer. If you don't have a chance, you don't actually leave it empty. I prefer marking it and leaving it empty, because then when I finish the block, I come back a second pass, I read it, I feel comfortable because the block is pretty much done. I can have my all focus on the question itself, and then just use the same formula that we usually do in our questions. Read the last 3 lines, read the whole scenario, knock out whatever answer is incorrect, and come down to 1 or 2. And at that point, it's a 50-50. If it's 50-50, choose the lowest letter and move. If it's 50-50, choose an answer that you have a feeling that is the right answer, right? A certain sense that is the right answer. And if you don't have an answer choice, click the lowest letter and move. All right. So try that approach, mark and come back to it. I promise you it will work, because if you struggle to do it now in a timed fashion, you will waste valuable time and then actually compromise the questions that are waiting for you throughout the block. And the last technique to improve scores and efficiency on your exam day, I actually touched a little bit in the previous technique. It's flagging when to do it. Many students are scared of flagging because when you flag, meaning when you mark, you flag, you might have 10, 15, 20 flags per block. I would suggest when you are prepping for USMLE Step right now, and you're actually just going through questions in a focused block, focused manner, trying to figure out how to read the question, how to implement what you know from your videos and textbooks and first aid onto the actual question stem, I would flag as many as I possibly can, which they confuse me. I need to go back a second time to look at. I'm not sure about the content. So that flag is an opportunity for me to go back and look at it. Now, when you're doing simulation, flagging and marking is the same thing. When I flag, I know I got to come back to it. So I want you to practice this technique, because I'm telling you, 7 blocks in one day is a lot. And then step 2 is actually 8 blocks, right? So step 1 is 7, step 2 is 8. If you practice the right techniques now, you will guarantee score higher on step 2. So if you're flagging, I know a lot of schools tell their students don't flag. If you're flagging at the beginning of your studies, is good. You want to see your progression as you move week by week, month by month. Eventually, you'll have less flags per block, right? Flags are good to make sure you're going back to looking at the information, to make sure that you're addressing what the problem is. So if you have a simulation, you flag, which is mark and move. If you are in tutor mode, you flag to say, well, I got to go back and take a look at it. I'm not sure, why I got it wrong, or, what's going on. What was the exact reasoning behind this? Basically highlighting to me, or pointing out to me, Stavros, I got to go back and really pay attention to this. Okay. So these are techniques that I can guarantee. I know it's not easy at times, but if you do implement this each and every day, and then students in our live sessions, we do that twice a day, every single day. And if you're one of those students, you know exactly what I'm talking about. I guarantee you start seeing your scores rise, because content only goes so far. Then you have to be a test taker. There's no test taking skills course in school. They just teach you the content. So make sure that when you're preparing for this exam, step 1, step 2, step 3, if you see that your score is not rising, there must be a reason why, right? That's why we put these videos together, to say, well, these are the common mistakes that students make, so don't do them, all right? And these are techniques that you should implement to take the test and pass, because we see our students pass. And today is a Wednesday that I'm filming this, and on Wednesday, students pass. We get results, obviously pass for step 1, step 2. And I'm happy to report we've had many students pass their step 1, and quite a few students pass step 2, including high 250 plus scores. So we know what works, and that's why I'm putting these videos together, to provide some knowledge to you. All right. Hey, doc, so there it is. You now know the most common mistakes students make when they prep for step one and how to really improve to be efficient and effective on exam day through using techniques in your test prep. You must make sure that you know about these mistakes and you must work day by day working on techniques. You need to be able to integrate these strategies each and every day. So watch this video side by side when you're answering questions, put it on pause, implement these techniques when you're answering questions on UWorld versus Amboss. Take your time, read the last 3 lines, then go to the top, right? Eliminate everything one by one, strengthen not only your basic science, but actually having the confidence to know that on exam day, you're going to walk in with super confidence because you read the scenario, you know the answer. You read the scenario, you don't know the answer. It's okay because you can go ahead with confidence to knock out all the wrong answers to then highlight the right answer. And if you practice this each and every day, you will see not only improvement in your basic science foundation, which some of you might need a little more some more time to brush up on your basic sciences, but I guarantee your test taking skills of flagging, moving, last 3 lines, implementing everything that I showed you in this video, you will start seeing a higher score, not only in your assessment tests, your normal, regular Q banks on a daily basis, but then you'll pass your NBME in school. That then will then allow you to be sponsored by your med school to then sit for the step. You pass your step exam, and then all this information that I sent to you, that I provided you today, the common mistakes and the techniques, you will then use it, I promise you, in your shelf exams when you're in your rotations, and then attacking your step 2 CK to score very high, to then applying for residency one day in the specialty that you desire. All right. So I'm Dr. Stavros with USMLE Trainings. I'm happy that you came and you joined us today watching these videos. I thank you for your time, and I'll see you guys soon, especially on our workshops.